Welcome back to another episode. Today we're going to be diving into a topic that affects so many women, and that is pregnancy and gallbladder issues. So we'll explore why gallbladder problems are more common during this unique and important time, what you can do to manage symptoms, how to prevent painful attacks, and ways to avoid emergency removal during pregnancy. I've also gathered some of the most frequently asked questions from my Instagram community at gallbladder.nutritionist, and I'll be answering those at the end of the episode as well. So we have lots to dive into today's episode. And there's a lot that we're going to cover. We're going to get an understanding of why pregnancy increases the risk of gallbladder issues. And it is well known that gallbladder symptoms are more common during pregnancy and throughout the fertile years of a woman's life. But why is that? Most of us women are not educated on it. And I wish, dealing with gallbladder issues myself, I wish we were, because it can really help to understand this and help to understand your body during pregnancy, to be aware of your gallbladder, how to support it, and mitigate issues as much as possible. And the connection all starts with a powerful connection between your hormones and your gallbladder, specifically fluctuations of estrogen and progesterone. And that's exactly what we're going to unpack next. So let's talk about estrogen and progesterone. So estrogen is a hormone that plays a major role in the woman's reproductive system. So estrogen really helps to increase basically your uterine muscle contractions. It helps to increase strength, tone, and ability of the uterine muscles to contract and prepare for delivery. Estrogen also helps build a strong uterine lining for a fertilized egg to grow. So basically, first trimester, estrogen levels will start to rise steadily as the body shifts from ovulation to pregnancy. Then second trimester, your placenta takes over, and estrogen production and levels start to climb even more rapidly. Then third trimester, estrogen skyrockets, reaching its peak in the final weeks before delivery, sometimes up to 100 times higher than pre-pregnancy levels. And then we have progesterone. Progesterone is another key reproductive hormone. We think of it as the calm protector hormone during pregnancy. It works alongside estrogen, but it specifically helps to maintain a safe environment for baby to grow. So progesterone helps to prepare the uterus for implantation. It helps relax muscles, including the uterus, to keep it from contracting. It also relaxes the digestive system, which is helpful for nutrient absorption. But it can slow things down. So this is where constipation can come into play, and also your gallbladder, which we'll cover more about that. Progesterone significantly rises in third trimester and declines towards the time of delivery, allowing estrogen to increase contractions. So now that we understand what's going on with our body during pregnancy, let's chat about why maybe estrogen and progesterone levels can increase risk of gallbladder problems. So estrogen and progesterone levels significantly start to rise during first trimester, and they continue to increase steadily until third trimester. And estrogen increases drastically at the end of third trimester to prepare for labor. Most individuals that have gallbladder problems, and I can speak from personal experience as well, increase gallbladder symptoms during your first and third trimester. So if you're aware of this and you're going into pregnancy with known gallbladder issues, you can be mindful anywhere around week 5 to all the way up to week 10 to be mindful about gallbladder trigger foods, taking it slower, all these things to help support our gallbladder. Same thing during third trimester is that if you have gallbladder issues, as the hormones start to rise in third trimester, you might have to slow down more because your gallbladder is becoming more symptomatic. And although these hormones are necessary for baby's growth, there's nothing we can do. The gallbladder can take a lot of stress and your liver from the surges in estrogen and progesterone. And it can depend on so many different factors, and we'll talk about that. But also it can really depend on what a female does for preconception prep, if they do any gallbladder liver support beforehand. All these factors can make a difference. But these are two factors that contribute to the development of gallstones, sludge, and poor gallbladder function during pregnancy. And so between estrogen and progesterone, basically, it will cause slowed gallbladder motility, slow gallbladder contraction, and thicker bile. So let's talk about this. First, progesterone. So progesterone binds to receptors and it slows gallbladder motility, and it impacts your sphincter of Oddi, which can contribute to biliary stasis, cause issues with bile flow. So we have an issue of poor gallbladder contraction. And when there's poor gallbladder contraction, we have an increased risk of gallstones. But also, if we have poor gallbladder contraction, sometimes we can have gallbladder symptoms related to that, from constipation to diarrhea to intolerance to fatty foods. And then high estrogen levels during pregnancy, especially during third trimester, will cause cholesterol supersaturation of bile. And so anytime we have bile that is being produced where it's higher amounts of cholesterol to bile salts, it's too sludgy and it's thick. And the high estrogen levels can also impair gallbladder function. And so we have this combination of poor gallbladder contraction and a very thick saturated bile that just sits in the gallbladder, and we have a high risk of gallstones developing and gallbladder attacks. So during pregnancy, risk of gallstones is particularly high in the third trimester due to elevated estrogen levels. So again, what we do in preparation leading up to third trimester or leading into pregnancy can really help reduce down this risk of gallstones increasing or possibly developing gallstones or gallbladder attacks becoming more frequent. So to basically summarize, gallbladder issues increase risk during pregnancy due to the following mechanisms. So we have increased hormones and changes specifically in progesterone and estrogen during pregnancy will impact your normal digestion. They will also affect bile acid composition, so it'll cause cholesterol supersaturation in bile, basically sludgy bile, and also promote poor gallbladder motility. And this will increase the risk of gallstones, gallbladder pain, upper right quadrant pain, or gallbladder attacks during pregnancy leading into postpartum. And these gallbladder symptoms can even be more common even months going into postpartum. And I just want to emphasize that I have another episode that talks about postpartum support, because I know as a fellow gallbladder warrior and nutritionist, a lot of females are told their gallbladder issues go away after pregnancy. And I wish that was the case, but unfortunately it's not. Postpartum can be certainly a challenging period for gallbladder attacks as well. And the thing is that there's a lot we can do, and we're going to talk about in this episode what we can do to support our gallbladder and liver, because they go hand in hand during pregnancy and leading up to pregnancy. One thing is that, gallbladder issues, certainly they will develop pretty quickly through pregnancy. But if a woman enters pregnancy with an imbalance of estrogen and progesterone, they are at a higher risk of developing gallbladder problems. So gallbladder issues, even though they can increase rapidly during pregnancy, often a woman going into pregnancy that develops gallstones or gallbladder attacks typically already has a higher rate of estrogen levels leading into pregnancy, or what we call estrogen dominance. And then during pregnancy, basically the high end of estrogen will increase gallbladder liver problems, or basically I like to say it brings them to surface. So if you have known gallbladder problems, or in general, if you're planning for pregnancy, something you can really do is plan to do some preconception prep to really help support your gallbladder and liver and help support estrogen detoxification if this is an issue for you, because it can really, really help to optimize your gallbladder liver health during pregnancy. And I tell you, with my first son, I spent about 6 months after removing my breast implants leading into pregnancy. I did a ton of detox work, and I really think that this drastically made my pregnancy a much easier experience. And so that's typically what I work with a lot of clients, and in my Gallbladder Saver Society membership, is really talk about preconception prep, talk about a lot of prep going into pregnancy, especially if you're concerned, like if you already have gallstones or gallbladder issues and you don't know if going into another pregnancy is right for you. And we have to keep in mind it's pregnancy and postpartum. It doesn't stop at postpartum. Doing a lot of that preconception prep is really important. So doing as much detox work, really optimizing these two detox organs as much as possible can really help. So certainly we have these estrogen and progesterone fluctuations that are going to contribute to gallstone formation during pregnancy. There are, of course, other factors, and I just want to talk about these briefly. So obviously a processed food diet. So a processed food diet will obviously increase cholesterol supersaturation in bile. And so we have to take that into account. Obviously, it's not a healthy diet for mom and baby. So this is a period of our life where we really do want to spend some time cleaning up our diet, detoxing it as much as possible, focusing on whole foods over processed foods to not only optimize our health, our gallbladder, liver health, but also support a healthy baby. There's some research that also shows vitamin D deficiency has been linked to increased risk of gallstone formation during pregnancy. So vitamin D helps to regulate bile salts, which help prevent gallstones. So studies have shown that vitamin D deficiency during pregnancy has been increased risk of gallstones. And then we have obviously decreased function of the gallbladder or biliary dyskinesia, which is a functional disorder of the gallbladder. So if we have already a gallbladder that's poor functioning, which I have a history of this, going into a pregnancy, we do have a risk of developing gallstones and sludge during that time because our gallbladder is already poorly functioning. It's not contracting well. So this is why, again, it's really important we're aware of this and we do a lot of things to support and optimize the function of the gallbladder and your liver health and the bile composition all throughout pregnancy to mitigate the risk of developing gallstones and sludge during this time. Choline deficiency has also been linked to increased risk of pregnancy and gallstones. And so choline is necessary for fat metabolism, healthy bile composition, bile flow, and preventing fat buildup in the liver. And the need for choline significantly increases during pregnancy for baby's health. But choline deficient diets increase the risk of gallbladder and liver problems during pregnancy. And so it's really important we get choline. But the hard thing is that choline is found really rich in eggs. And often eggs are a trigger food for gallbladder attacks. So you can imagine why choline deficiency is common. And so this is a nutrient that typically I do recommend to moms to supplement, as well as if they're able to eat eggs, making sure you're getting in eggs a couple times a week is helpful during pregnancy. Then we look at genetics. So there are certainly genetics playing a factor during pregnancy and gallstones. So we have your PEMT gene mutation, which is a gene that tells your body how to make an enzyme in the liver that produces phosphatidylcholine, so a main component of bile. During pregnancy, as I mentioned, your choline goes way up for baby's development and for your liver to function well. Basically, if there's an issue with this gene SNP, then there's less phosphatidylcholine and bile becomes too thick or unbalanced. And then we have a higher risk of developing gallstones. So again, this is where genetics come into play. But again, your genetics is only a small piece of it because our diet and lifestyle turns these genes on over time. So we want to keep this in mind. And then obviously we have MTHFR gene mutation, which is very common among individuals with gallbladder liver issues. And MTHFR is a gene involved in methylation. And during pregnancy, methylation needs increase drastically. And if we have MTHFR gene mutation, which more than likely, if you have a history of gallbladder liver issues, there's a high chance you do, you will struggle with estrogen detoxification and methylation. Both factors increase risk of sludgy bile and gallstones. So this is where the genetics come into play. Again, there's a lot you can do to support your genetics, and that's through your diet and lifestyle choices. So really optimizing your gallbladder liver health can help with this. Okay, so now that we understand why gallbladder issues are common during pregnancy, what can we start to do to mitigate our risk of gallbladder attacks, issues, or possibly prep for pregnancy knowing we have gallbladder issues? So during pregnancy, the key things I always focus on with clients is the basics. And that is going to be diet, stress, sleep, detox through your bowels, your stool, and supplementation. So let's talk about all of these. So diet. So during pregnancy, your number one tool that you can do to support your gallbladder and liver health that's within your control and prevent gallbladder attacks is your diet. So simply put, we want to take this time to detox our diet, or before, ideally, by focusing in on quality whole foods over processed foods. So it's really important we get back to the basics. We bring our kitchen back into the home. We eat whole foods over processed foods. As simple as that. We want to avoid filling the diet with lots of dairy-free, low-fat, fat-free foods. Instead, you need to focus on the quality. I see this happen with moms all the time. They deal with gallbladder attacks, they're diagnosed with gallbladder issues, and their doctor tells them you have to remove fat from the diet. Well, that's not realistic, and it's not healthy for you or mom or baby. So this is not what we want to do. But what happens is mom will go and fill a lot of those dairy products and foods that have fat with them, and they'll fill it with a lot of fat-free, dairy-free processed foods. And this does not help the problem. Instead, the quality really matters, especially when it's your gallbladder liver. So we want to focus on quality foods and foods that really help support our gallbladder and liver during this time. And then we want to aim for small, more frequent meals. And the reason why is because the gallbladder has a hard time with contraction during pregnancy into postpartum. And so if we eat large meals at once, we don't eat frequently, we eat a large meal at once, we go out to eat and we eat a large meal at once, we have a higher chance of having a gallbladder attack. So typically I advise moms to eat small, more frequent meals. So I average about 5 to 6 small meals during first trimester and close to 8 by third trimester. And this can really help with reducing down gallbladder attacks, but also ensure that mom gets enough fats in the diet. So with each of these small meals, we include a small serving of healthy fat. This, along with protein intake, helps to ensure moms get enough fats for their health and for their babies. So this is an easy little tip that could kind of trick the system to make sure that you're getting enough fats. And then we do want to avoid gallbladder trigger foods. And this is the hardest thing for mom, because especially if she's dealing with a lot of food cravings. But it's really important we avoid these gallbladder trigger foods because your gallbladder is very sensitive during this time. So obviously gallbladder trigger foods are fried, greasy foods, corn, soy, too much sugar, fatty red meats, pork, gluten. We want to caution with nuts, sometimes overdoing it with nuts. Most individuals do better with seeds. Again, eggs can be trigger foods, but are rich in choline. So if they aren't an issue, please keep them in the diet. And then dairy. Dairy is one of those hit or miss foods that can be triggers or not. But I typically just advise minimal amounts of dairy, like a skyr yogurt, Greek yogurt, goat products, and again, individualize. And then fatty red meats. So stick to more lean red meats. So things like bison, like a 90% ground beef, venison, these all work great. Red meat was a big trigger food for me for a long time. And when I was pregnant with Ethan, I craved red meat like crazy. And so I had to bring it back in, which was terrifying during pregnancy. But I did bring it back in and was successful with eating it very minimally in the diet. The diet is probably the hardest thing for mom during pregnancy. So if you're really struggling to eat enough foods, feel satisfied in your diet, worried that you're not getting enough nutrients for yourself and baby, I would highly recommend you work with someone. This is the number one thing that I typically work on with most moms during pregnancy, is just making sure that we optimize this tool through our diet so that mom's healthy and baby's healthy, and we're reducing down the risk of gallbladder attacks. So I'd be more than happy to help you with a one-on-one or in my Gallbladder Saver Society membership, and I'll share more info at the end of the episode. Stress and sleep, these go hand in hand. So the gallbladder is very sensitive to stress. If you have known gallbladder issues, you know this to be 100% true. So with higher cortisol levels, this will cause a decrease in hormone CCK and gallbladder contraction. And the gallbladder function already declines during pregnancy into postpartum, and high stress levels will increase this issue. So it's really important that we consider this a period of your life where you slow down, you ask for help, you go to bed earlier, and this also applies during postpartum. And I wish someone had passed this tip on to me because I had to learn the hard way into pregnancy, postpartum. So definitely need to consider your stress and sleep during this time. And then next tool is detoxing through our stool. So during pregnancy, we obviously can't push detox. The only method of detox is through our stool and ensuring adequate fiber intake. So fiber acts as a natural binder for excess toxins, estrogen, and waste products. So it's really important we ensure we're eating a minimum of 30 grams of fiber per day. Most of my moms said that they found eating like a serving of beans to 2 servings a day really helped, including like gluten-free oats, apples, pears, carrots are really great. And then the second piece of this fiber to ensure we're having a safe detox is through constipation or working on constipation. And this can be so challenging because constipation can be caused by many factors, from the hormonal fluctuations that are going on. It's tough. And so do the best you can. There's a lot of natural remedies you can do to support the constipation, but do be mindful about your bowel movements because it's our way of detoxing, helping to protect our gallbladder, liver during this time. So incorporate soluble fiber sources, gluten-free oats, beans, apples, pears, kiwi, dragon fruit. And then typically we have to incorporate with constipation magnesium citrate and occasional magnesium oxide, also ensuring that you're getting lots of potassium and sodium to also support healthy bowels. And then supplements. So supplements can be super helpful to support pregnancy, gallbladder, and liver health. And before I review this, please note this is not medical advice and discuss supplementation with your medical provider or midwife prior to executing. So I like to break this down into different categories. So the number one thing that typically we need to look at is digestive support. Digestive support can be super beneficial if you're struggling to digest, absorb fats, you're having a lot of sensitivities to fats. In this case, then we got to look at a lot of digestive support. So different ways that we can support our digestion and fat digestion specifically during pregnancy is considering a bitter before a meal to optimize digestion. And this can be lemon water, little apple cider vinegar and water before meals, ginger tea, dandelion root tea, just some form of bitter component. And then after meals, to further support digestion and fat digestion, we may want to consider digestive enzymes with ox bile. The ox bile can be specifically supportive to help support fat sensitivity and ensure mommy is able to eat enough fats during pregnancy. And so typically we take these with our main meals. And then choline CEP or phosphatidylcholine, as we talked about, choline is a very important nutrient for pregnancy, but choline deficient diets increase risk of gallstones and sludge and fatty liver during pregnancy. So it supports fat metabolism, bile composition, prevents fat buildup in the liver, and it's really important for your baby. And then obviously with prenatals, you can either select a good quality prenatal, make sure that it has the form of methylfolate, not folic acid. Again, this is often due to individuals typically having MTHFR gene mutation with gallbladder liver issues just out of precaution. Typically select methylfolate. Again, with prenatals, you can supplement individual key nutrients. This is what I've done. It does require a lot more supplements, but it's up to you which route you'd like to go. Herbal teas that are helpful: dandelion root, ginger, peppermint, alfalfa, red raspberry, milk thistle seed. These can all be considered. Typically first trimester, I just try to keep it safe with ginger, dandelion root tea. Fiber, acacia fiber or partially hydrolyzed gorgum, sun fiber, and psyllium seed husk fiber. These can be used as supplementation for additional fiber sources. NAC helps to produce glutathione, which is a main antioxidant to support the liver. Magnesium glycinate magnesium is a very important mineral for many different functions. When it comes to constipation, it's a key nutrient for hormone health. For liver health. So magnesium, typically most people are deficient in. So making sure we're getting adequate magnesium through supplementation, maybe even doing magnesium spray or Epsom salt baths. And then if you're leaning constipated, you can certainly use magnesium citrate or minimal use of oxide for constipation. And then focusing on electrolytes to support your hormones, again, support healthy digestion, detoxification. This is a gentle way to support the body and mom, help replenish the mom during pregnancy when there's a high need for minerals and going into postpartum. So typically I just focus in on magnesium, potassium, sodium, and then certainly you could do an HTMA to assess your mineral status and individualize your minerals. And then if you have cholestasis, some considerations to discuss with your doctor is obviously ursadile, TUDCA, selenium, and NAC. Again, this supplements is not medical advice. Please review these with your medical provider or midwife prior to. All right, so that sums up we covered why gallbladder issues increase during pregnancy and some strategies to help support mom and during pregnancy to help support our gallbladder or liver and reduce down the likelihood of gallbladder attacks. Now, I gathered some questions again from my Instagram community at gallbladder.nutritionist. So I want to cover some of those common questions that were submitted. So the first question is safe ways to relieve gallbladder attacks during pregnancy. So the safest way is you can apply a low temp heating pad or hot water bottle, or use Epsom salt bath. So some moms find a lot of relief getting into an Epsom salt bath. And then you want to sip on a gallbladder attack cocktail. And so this can look different for everyone, but typically what works well for most is apple cider vinegar. So they'll drink about 2 tablespoons apple cider vinegar in water. Another option that works well for many moms is magnesium calm, also doing very strong lemon water. And then you could certainly try homeopathy as well. And I would work with a homeopathy practitioner to help you. And then if you're able to, you can massage under your abdomen if able to, if you want to walk or do a gallbladder meridian stretch. So there's this really awesome gallbladder meridian stretch that my members in the Gallbladder Save Society love. It's super helpful. If you just search on YouTube, gallbladder meridian stretch, you can find some there. But it depends what works well for you. I personally use massages when I feel the pressure there. Gallbladder attacks, some people say walking works really well. But you do want to ensure deep breathing. So whatever activity you end up doing, just make sure you incorporate deep breathing. Try to calm your nervous system as much as possible so we don't go into kind of fight or flight. This will help support your gallbladder as well. And let your body do its thing. So typically 4 counts in, hold at the top, and release for 4. Okay. Gallbladder sludge. So diagnosed with gallbladder sludge. How to avoid getting gallbladder out in second trimester. So obviously reference all the recommendations on this podcast. So work on the basics, your diet, sleep, stress, and supplementation. And then certainly seek out more support if you're struggling with diet and supplements. Again, I can help you more inside my Gallbladder Save Society membership or one-on-one. If you do get a stone or sludge stuck, sometimes they pass on their own. Do make sure that you hydrate, apply heat and magnesium calm during attack. If you suspect a blockage, then certainly go into the emergency. And typically when individuals have blockage, they kind of know, like the gallbladder attack lingers on for a lot longer. They're maybe throwing up water, signs of jaundice. The pain just feels different. And they may have fevers, just different symptoms. Typically, all my clients that have had blockages, they typically knew. And the sooner you go in, the better. So if you are concerned in general, like you have a gallbladder attack, you're concerned, then certainly go in. It's better you go in sooner than later to prevent any emergency. But if you do have a stone or a sludge that is blocked, you can choose to do an ERCP to remove the blockage. And you can choose to do surgery second trimester or wait until postpartum. I would typically try to avoid emergency removal and opt for ERCP if necessary and schedule a surgery with a skilled surgeon who has experience removing gallbladder during pregnancy to reduce down the risk of complications. I will say I've helped many thousands of individuals during pregnancy and gallbladder issues. I have only ever had one client remove her gallbladder in second trimester. And typically most of my clients have more symptoms during postpartum than I would, they say, during pregnancy. So I have not seen this to be a huge risk factor, but if you're concerned, in this case, this is where you need to develop a support system, and that will help build up your confidence. So make sure that if you are concerned, you are speaking to your OBGYN. You may work with a gastroenterologist. Seek out a surgeon that has experience removing gallbladders during pregnancy and talk about the questions and concerns with them. And that way then too, if you know that possibly there is this risk during second trimester, or you're worried about removing the gallbladder in second trimester, you have a skilled surgeon lined up. Again, when we talk about your hormones, the toughest time for the gallbladder liver is going to be your first trimester and second trimester. It's more rare that people have issues during second trimester. So this is where we have to rely on all these other tools to help, okay? How to heal sludge and inflamed gallbladder while breastfeeding. Again, this is where it's relied mostly on your diet. So the first things first, if we have an inflamed gallbladder, we have to work on this first. And so this is where typically I would make sure you're executing a post-gallbladder attack diet to work on gallbladder inflammation, work on supporting your liver, using supplements to help bring down the gallbladder inflammation. Then we work on detox or phase 3 detoxification, which is through your bowels. So ensuring that you are having frequent bowels. You can certainly add in different supplements during breastfeeding to help work on the sludge. But the first thing in this situation where we have sludge and inflamed gallbladder, we first have to make sure mom is not in pain and she's not having attacks. That's the number one goal. And if we have an inflamed gallbladder, typically mom is more sensitive. So that's why typically we have to work on the inflammation first. And again, you can work on that through a lot of dietary and supplement strategies. Gallbladder safe breastfeeding foods. So when we look at breastfeeding foods, the first thing that I look at with moms is one, to make sure they're eating enough. Typically with most postpartum moms dealing with gallbladder issues, they're not eating enough, right? Because we're afraid of food. And so that's the first thing I'm working on with them, is making sure we're eating enough, we're supporting that fat digestion. And 2, ensure that you're eating balanced meals. So all your meals have adequate protein, carbohydrates, fiber, and healthy fats. This will help you keep satisfied, especially as you are breastfeeding. Ensure that you eat small, more frequent meals. This will help prevent the likelihood of attacks and help keep you satisfied, so then you aren't craving certain foods. And I don't know entirely what breastfeeding safe foods are. Personally, I just lived off a lot of leftovers as much as possible when I was breastfeeding. Whatever I could find in the kitchen basically was all leftovers. But one breastfeeding food that did come to mind when I got this question is, I personally found overnight oats my lifesaver for breastfeeding. So it was a combination of gluten-free oats, chia seeds, flax seeds, acacia fiber, a little coconut yogurt. If your gallbladder is sensitive, then obviously omit this. And then I added Equip protein powder and berries to it. And so I often made this. I would eat it before bed sometimes if I was starving, or like if I got up in the middle of the night and I was breastfeeding, then I would eat that. I had like a little fridge that I would put that in, and I found that to be a lifesaver and found it quite satisfying. All right, so next question. So should you get surgery before trying to conceive? This honestly depends on the health of your gallbladder. And, like I said, it just depends on the health of your gallbladder. So if you're going to pregnancy with a lot of gallbladder attacks, if your gallbladder is completely full of gallstones, we have wall thickening, that's kind of a higher risk situation that you may want to discuss surgery with your doctor. If you have had a history of a lot of pancreatitis, a lot of gallbladder infection, this is probably a sign that surgery is best before going into pregnancy. And then 2, you have to feel confident, because, you can't go into pregnancy with known gallbladder issues concerned the whole time if you're going to have gallbladder attacks. It's not going to be fun. And 2, it's just going to cause massive stress on you. So if you're feeling concerned, the confidence is not there, this is where then I would work with like an integrative functional practitioner myself, or a naturopath, someone that can help you. But I would suggest you build out a support team, because pregnancy comes with its own challenges and it can be quite scary sometimes. And when you add gallbladder issues on top of that, sometimes it's best to just work with someone, or again, consult with someone that has a little bit better understanding of your gallbladder's health beforehand. So what to do when you have tons of triggers and afraid to eat? Ways to stop. I'm having issues pre-pregnancy. Is it going to get worse during pregnancy? So if you're already really sensitive to foods, you're afraid to eat pre-pregnancy, this has to be addressed, because this could be an issue that the gallbladder health is just declining. I don't know. It could also be an issue that our diet is not dialed in. Maybe we're not taking the right supplements. Maybe there's just other factors that we have to consider. So if you're having issues pre-pregnancy, I would suggest you work on these beforehand. So work on a lot of the food triggers and the issues with food fear, because again, these aren't going to go away during pregnancy. you have the risk during pregnancy. And I think most of us moms forget, or maybe we're a new time mom and we have no idea what to expect between pregnancy and postpartum. And this was my case with Ethan, is that pregnancy issues don't stop at pregnancy. We have all of postpartum that has to be considered. So it's the next anywhere from year to 2 to 3 years of your life that you're committing to this lifestyle. And so you have to take that into consideration when you're talking about preconception prep, gallbladder tax, lots of gallbladder trigger foods, and planning for pregnancy. It's a very difficult thing. And so that's where I would say the best thing I ever did for myself was have support during pregnancy into postpartum. And it really did help, because third trimester, I had a really great pregnancy, but third trimester, I did get COVID and it hit my liver pretty hard. And I was getting monitored for cholestasis my third trimester. And I ended up developing chronic upper right quadrant pain all of third trimester. It was very scary, but I had my naturopath that helped me. And by having her step in, we were able to get my liver enzymes normalized pretty quickly, and the itching went away, and she supported me all through pregnancy into postpartum period. So that really did help with a lot of those issues that just came up out of the blue, and really helped me feel a lot more confident dealing with everything. Okay. Now I have questions about pregnancy without a gallbladder. So pregnancy without a gallbladder, when it comes to pregnancy without a gallbladder, I'm not sure entirely this whole question, but the biggest concern typically for people without a gallbladder is issues with their digestion and issues with digestive issues like diarrhea, reflux, constipation. If they're already struggling with this before gallbladder surgery, how to navigate that during pregnancy. And as we know, during pregnancy, there's so many hormonal fluctuations that are going to naturally cause issues with like constipation, reflux, bloating, things like that. And so the two things that I always look at with post gallbladder surgery clients is optimizing digestion, which we covered a lot of tips in this podcast. But secondly, your liver, really focusing in on your liver, because your liver has a hard time during pregnancy with the hormonal fluctuations, and there is that increased risk factor of cholestasis. So we want to do as much as we can to support our liver during pregnancy. And again, that's going to be detoxing and optimizing our liver health through our diet and lifestyle strategies. So as we talked about in today's podcast, our diet, sleep, stress, moving our body, looking at key supplements, and detoxing through our stool. So all of these things that we talked about in the podcast can be certainly applied for individuals without a gallbladder as well. If you're without a gallbladder, please reach out. I'd be more than happy to help you in my Gallbladder Gone Support Society or one-on-one as well. And then cholestasis after having gallbladder removed, is it related? Yes, it can be. Cholestasis can be common after gallbladder removal. Cholestasis is often caused by hormones, high estrogen levels, and liver stress, poor bile flow, and we have genetics. But between the poor bile flow, it can cause detox overload of estrogen toxins waste in the liver. And so without a gallbladder, bile flow changes, right? And liver takes on added stress. If these factors are not optimized after gallbladder removal, this increases cholestasis risk on top of genetic factors. So again, everything that we do to support bile, digestion, and your liver really helps to reduce down the risk of cholestasis. So again, if we're post gallbladder removal, preconception prep is still just as important. I wish, more moms were told and encouraged when you're thinking about having a baby or going into a second or third pregnancy, doing a lot of preconception prep, a lot of detox work beforehand is really beneficial. You'll have a much better experience through pregnancy into postpartum if you're able to allocate time for this. And obviously I know sometimes baby's a surprise. And if baby's a surprise, again, we can do a lot to support our body without having a gallbladder and support our liver. Again, everything in this podcast can be totally applied if you have no gallbladder as well. All right, so that wraps up today's episode, all about pregnancy and gallbladder care. I hope it gave you some clarity and comfort. I know how challenging it can be to manage gallbladder issues, especially when you're pregnant or navigating postpartum. It's a lot, and you don't have to do it alone. So if you're feeling overwhelmed, scared, or stuck knowing what to eat, I highly encourage you to reach out for support. It makes a huge difference. As I mentioned, I had support through my pregnancy and postpartum, and it was the best thing I ever did. So I'd be honored to help you one-on-one, or you can join my Gallbladder Saver Society membership, where I offer dedicated pregnancy guidance and resources to support you every step of the way. So you'll find more info about both support options in the caption below. And if you found this episode helpful, please pass it along to another gallbladder warrior who might be struggling during pregnancy or postpartum, because we all know we need it. So thanks so much for tuning in, and I hope you have a wonderful day.